And the South Carolina Department of Public Health has reported 15 new measles cases. That brings the grand total of reported cases statewide to 129. Now, while most of these cases have been in the upstate, a local infectious disease physician says there's still a risk of spreading it right here. WSV's Danielle Cobb tells us what to look out for and how you can potentially prevent exposure.
Fear of a larger outbreak is still on doctors' minds. That's because they say it takes something as simple as touching or transferring groceries to your home that can lead to an exposure of the measles virus.
As people travel, as people gather and congregate, the concern is that there will be more hundreds and maybe thousands of cases if we're not careful.
And the concern is high because the virus, according to health officials, is extremely contagious and can survive up to 2 hours in the air and on surfaces.
Holiday shopping, going to the mall, going to Walmart, going to things. You never know where you can get exposed.
They say measles is most contagious in the first 4 days of exposure when some people may not even be aware that they have contracted the virus.
90% of exposed unvaccinated individuals get it after being in contact with someone with measles. You could contract it from a completely asymptomatic individual at your church, at your school, at the mall. So being in a certain corner of the state doesn't guarantee protection.
Symptoms include fever, a rash starting on the face and spreading to the body, runny nose, and a cough. Officials say the measles vaccine has been proven safe and is highly recommended. One dose gives a 93% protection rate, a second dose, 97%.
Vaccination significantly reduces transmission of measles in particular. The other thing I would encourage for people to notice is the consequences of measles itself, because measles in 1 in 1,000 cases will cause horrible, debilitating neurological disease. In 1 in 100 cases, it could cause horrible pulmonary or gastrointestinal disease.
The South Carolina Department of Public Health reports that 119 out of the 129 reported cases were unvaccinated, 3 partially vaccinated, and 1 received both doses of the measles vaccine. Exposure to unvaccinated and vaccinated individuals is a 21-day quarantine. Danielle Cobb, WSAV News 3, on your side.